This is Dr. Robert Bates at Leominster Chiropractic Spine and Injury Center. Today we're going to discuss 10 facts about whiplash that you may not know. The first is that pain is not the only symptom of whiplash. Even though neck pain, headache, upper back pain is the #1 symptom, there are actually 22 things that we can see, such as nausea, dizziness, problem with concentration, irritability. There are many symptoms that seem to not be related that are related. The second fact is that you can be injured at low speed, and sometimes you can have a severe whiplash as low as 3 miles per hour if some of the complicating factors are present. In other words, if you are unaware you're going to be struck from behind, then you don't have the muscles tighten up and you will develop a lot more ligament damage. If the headrest is more than an inch behind your head, it doesn't help much. After 2 inches, it supposedly doesn't help at all. And if it's too low, you can ramp over it. If you have shoulder harness in place, then you recoil off and it causes rotation. If you were looking to either side, there's a lot more damage because of compression of some joints and opening of other joints when you're hit. You also have factors of females and the older people that have a less stable neck or more fixated and more scar tissue have much more trauma with less flexibility. So it is important to get checked if you have symptoms, even with a very small accident, because you can have a whiplash. The third fact is that many people think if there's no vehicle damage, then there can't be any damage to the occupant, and we see insurance companies try to say this all the time, even though some of these vehicles are equipped with a bumper that can withstand 8 to 12 miles per hour and not look like there's any damage. And of course you can have a severe whiplash at 8 to 12 mile per hour impact. Next, I would like you to understand what happens to the cervical curve. If you saw this in slow motion from the side, it would probably create nausea for you. What happens is if you're hit from behind, your spine doesn't move until the seat starts to push you forward. As it pushes forward, each segment stair steps until the ligaments are pulled all the way or torn or both, pulling the next segment. So actually the normal lordotic curve creates an S curve, which is a very abnormal curve about 40 to 50 milliseconds into the impact. And this creates tremendous damage to multiple levels in your cervical spine. Next, we see that x-rays are taken in the ER to rule out fracture. And of course, very often they miss the major damage of soft tissue injury. So what we do at my office is, if depending on what we find in a very thorough examination, we may order flexion extension x-rays or specific lateral bending x-rays so we can prove and see that there's been soft tissue tearing. If we see that, we may actually order an MRI to look at disc or other torn structures. We next have the fact that resting is not the best thing to do. The only time you put a collar on and wear it is if you have major instability. Usually, according to the literature, you will have less scar tissue formation and have less future disability if you get moving as fast as you can, which is what we try to get people to do at my office. Next, we have the fact that whiplash can occur not only in an automobile accident, but anything that moves your body quickly without your head will cause damage to your cervical spine. If you fall abruptly, if someone pushes you from behind, if you're playing sports, there are many ways that you can have a type of whiplash. It's not just in an automobile. Next, we need to discuss a little bit about aging. If you are aged and over 30, you have begun to develop some arthritic changes in your cervical spine. And with that, you have a reduction in flexibility, which tremendously increases the risk of having tearing and damage when you have a type of acceleration, deceleration, or a whiplash trauma. Next, we talked a little bit before, but if you're female, your head weighs usually almost the same as a male, but your neck musculature is much reduced compared to a male. And therefore, you can have much more ligament damage in your neck because there's less stability of the musculature. Next, we see the fact that if you have these symptoms, do not ignore them. If you have pain in your neck, or sometimes it doesn't occur for hours, days, or even weeks following the trauma, get an appointment and get evaluated so that you are not one of the many tens of millions of Americans that are walking around right now with pain in their neck every day from an automobile accident. So drive safe, be aware, and if you have a problem, give me a call and we'll lead you in the right direction with laser therapy and interferential therapy, vibratory plate rehab, and other things we have at my office that other people just don't have in our area to get you back to the person that feels good. Have a great day.